Despite proof of vaccination requirements becoming all but obsolete in March, the Premier says a vaccine mandate for staff and visitors in long-term care homes will remain.
We have the mandates for the 2 doses. We're going to keep that in place. We want to make sure we secure areas for our most vulnerable.
By all accounts, LTC facilities are highly vaccinated settings. The latest provincial data shows more than 90% of residents have received a 3rd dose, and almost 65% have already received their 4th dose. As for LTC workers, around 85% have received their booster. The deadline for staff in the sector to get mandatory 3rd shots was recently pushed back until March.
The number one step that we can do to protect residents in LTC starts by protecting the staff.
During this pandemic, palliative care physician Dr. Emmett Arya has watched many elderly patients die from COVID-19. He says the virus is often brought into homes by well-meaning staff. But 3rd doses have been helping homes weather the Omicron wave and dramatically reduced the number of people dying in LTC. Without vaccines as a first line of defense, Arya predicts the impact of the variant would have been far more catastrophic than during the peak of the first wave.
You know, the roads were quiet, businesses were all shut down, schools were shut down, we were all in our own homes. And even with that, we saw a really devastating impact on long-term care.
As homes prepare to resume general visits from anyone 5 and older, with at least 2 doses starting next week, Arya says the province must take a cautious approach to easing restrictions, both in LTC and beyond.
Long-term care is not on some isolated island away from everyone else.
Caryn Ceolin, City News.